both local and international. On behalf of the PTF, I wish to welcome you to today's briefing, Thursday, 7th January 2021, the second in this year. As it is the custom, we would now invite the chairman of the Presidential Task Force, who is also the Secretary to the Government of the Federation, to now give his opening remarks. SGF, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I hope we've not been quite early for you today. However, we will just proceed with the briefing so that you can file in your reports and also attend to other things. I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for today, Thursday, the 7th of January, 2021. The Presidential Task Force is very concerned about the increasing daily numbers that we are recording. Yesterday, 6th of January 2021, we recorded 1,664 infections. This is yet another all-time high in Nigeria, and we must all take full responsibility through compliance and vigilance. It is better to wear a mask, observe social distancing, avoid crowded environments, wash your hands, keep basic hygiene, or use hand sanitizers, than to be on a ventilator. And you can see that from these figures, we had predicted it. And there is no gainsaying that if we continue in the manner in which we are behaving as a people and as a nation, these figures would keep rising. And consequently, it would increase in terms of hospitalization and numbers, and eventually we will begin to see increase even in fatalities. In our previous briefings, we have consistently appealed to all Nigerians to stay safe and act in most defensive and protective ways by complying with the MPIs, that's the non-pharmaceutical interventions already prescribed. We urge you all at this point to raise and be our brothers' keepers by taking the expected responsibility. We should remind our neighbors to do the right thing in view of the imminent danger facing us as a country and the world in general. Our records show that our tests per million, as TPM, is at 4,695, while our test positivity rate, TPR, is at 9.6%. And our case fatality rate has increased to 3%, having recorded 1,324 deaths so far. And these data are not encouraging. Nigeria just crossed the 1 million mark for testing across the Federation. Testing remains a key strategy of our national response. The PTF urges the subnationals, now referring to the states, to revamp testing and contact tracing in the bid to curb the menace of this dreaded virus. It is only through testing that we can know our status and treat early if infected. This will provide, among other things, evidence for effective feedback, course correction, experience learning, and sharing, as well as optimized documentation systems for future reference. Efforts are being made to increase the supply of oxygen to our health facilities across the country, like we mentioned the last time. And we did inform you that Mr. President has approved the establishment of at least one new oxygen plant in each state of the Federation, while the existing ones will be made fully functional. We'll continue to thank the private sector through COVID and other participating partners, as well as the Nigerian Air Force for their continued support. Sometimes at very short notices, they provide the logistical support in terms of provision of oxygen cylinders and also their movement to different locations across the country. As the government is working around the clock to secure a safe and right vaccines for the country, we call on the media, traditional and religious, as well as our community leaders to pass the right message to their followers so that together we can win this war against this virus. I see a lot of clips on the social media that do not transmit the correct message. Most of the messages that I've come across are bandying all sorts of conspiracy theories of how COVID-19 started, the timeline, some even suggestive of the fact that there is going to be a COVID-21. That's total misinformation. And we ought not to be giving credence to this kind of information that will cause our people to lower their guards. And when the vaccines are made available, they would have developed resistance to vaccination. To overcome some of these challenges, the PTF will intensify the risk communication and community engagement to create awareness. The shared level of doubt about this virus is alarming, and I call on everyone to become advocates in support of the national response. I take the privilege to say that I saw a clip by the comedian Ali Baba, and that clip has provided answers to several of the misinformations and distortions out there. If you have not seen it, I think it was an interview granted on Arise TV. Find that clip. And that clip basically gives a testimony of his experience and his candid warning to Nigerians about the reality of COVID-19 and the fact that it's not a thing that you can take lightly. The PTF is working to develop new health protection regulations to support existing COVID-19 protocols and to strengthen compliance with non-pharmaceutical interventions across the country. We've issued protocols, but we are going a step further to develop health protection regulations that would have application across the country. It has become embarrassing to note that some Nigerians continue to present fake results when traveling outside the shores of this country. Not only is it a risky thing to do, but also puts our country in a very bad light. This remains a major source of concern to the federal government, and the PTF has directed private laboratories to immediately put in place measures to validate results and ensure that all passengers are registered on the travel portal before samples are being processed to stop this very unwholesome activity. The national coordinator would elaborate on this during this press briefing, because we have to take steps to ensure that these criminal acts are not further perpetuated. The Presidential Task Force is aware that the world is at a critical phase of infections. We are constantly reviewing our strategy to emergency situations, especially in risk communication, vaccine hesitancy, fake news, and disinformation. And this is where the media has a big role to play, because you are the conduit through which we reach out to the Nigerian people. In your editorials, in your commentaries, the messaging should be positive, and Nigerians should be encouraged to comply with the MPIs as we anticipate the arrival of vaccines on the shores of our country very soon, and to give the correct perspective, the correct information about the vaccines, their efficacy and effectiveness, so that, like I said, vaccines will not be resisted when they are available. We call on the general public to remain focused on the drive to reduce the level of infection and make our country safe again. We urge the subnationals to enforce relevant measures that will help to curb the effect of this virus on our lives and livelihood. Some of us will be meeting tonight with the subcommittee of the National Economic Council, having a membership of governors from across the 6 geopolitical zones, chaired by the governor of Delta State, to further discuss the protocols and the health regulations that we are working on, health protection regulations that we are working on, and to look at the aspects of enforcement across the states of the Federation, and the need also to ramp up testing, open up the isolation centers to enable the subnationalities provide care for hundreds of our people that are getting infected on a daily basis. I now have the privilege and honor to invite the Director Hospital Services of the Federal Ministry of Health, representing the Honorable Minister, a director from the NCDC, representing the DG of the NCDC, and the National Coordinator to brief you on and from the technical perspectives. And thereafter, if there are any further updates from our ministers, you will take that, and thereafter we will be available to take your questions. I thank you all for listening. I wish you a great evening. Thank you.
And the Secretary to the Government of the Federation, Honorable Ministers present, please permit me to stand on the well-established protocol by the SGF himself. even as I appreciate this honor of representing the Honorable Minister of Health to present the Federal Ministry of Health briefing to this august gathering. As of yesterday, the 6th of January, 2021, new cases recorded were 1,354, with one death, unfortunately. The total number of cases tested is 1,004,915, while the number of confirmed cases is 94,369. Active cases stand at 15,764, and the discharge cases till date are 77,299. The number of deaths till date is 1,324, with a case fatality of 1.4%. The federal government is determined to ensure morbidity due to COVID-19 is reduced to the barest minimum, while improving on the fatality rate. Appropriate measures are being taken to achieve these objectives. Please recall that the SGF himself already informed the Nigerian populace that the federal government has approved the establishment of new oxygen plants across the country. This is in a bid to ensure that the case management, especially the critical care, is optimized. In addition to this, the Federal Ministry of Health continues to build the capacity of the critical care health workforce, particularly the intensivists and the biomedical engineers. As a second phase assessment of our isolation and treatment centers, we will be conducting verification of the challenges experienced by the centers shortly. This is to enable us provide appropriate intervention measures required to strengthen the isolation and treatment centers. We are not unmindful of our obligations to our health workers, particularly those in the front line. We appreciate them and urge Nigerians to encourage them in this challenging pandemic situation so that they can continue to give their best. We're also working very hard to get vaccines to our people. It may not come soon enough, therefore we need to be alive to get the vaccines when they come. The honorable ministers have brought this up to underscore the importance of compliance with non-pharmaceutical measures as advised to reduce transmissibility of the virus. We continue to appeal to the states to increase testing and contact tracing. The cooperation of the states with the federal authorities is critical to our collective objective of defeating COVID-19. I thank you for listening.
And good evening, ladies and gentlemen. Gentlemen of the press and gentle ladies of the press. Good evening. So today, I'm representing the DG and CDC, and we have talked more about the number of new cases that are rising. It is alarming, and we need to be very careful. Over the last week, we have done over 40,000 tests, and we have increased the national testing. That is, we need to increase the national testing And that's the only way we can understand the burden of the disease, particularly now that we are recording very high cases. Since the outbreak, we have actually all worked tirelessly to try as much as possible to reduce transmission, including our gentlemen of the press, giving out information, the right information. But then we also need to do more. The reality of the increasing transmission, the positivity rate, the test positivity rate, and confirmed number of confirmed cases remain a cause for concern in this second wave that we are into. There's therefore need for us to strictly adhere to the non-pharmaceutical interventions, and that is the proper wearing of our mask. I always say that it's not called chin mask, and it's not called under the nose mask. It is face mask, and that means we need to cover our nose and mouth. So we need to take this out and encourage those that are not wearing it well to put it on properly. We also need to do hand washing and maintain the physical distance. So at the NCDC, we have continued to, throughout the holidays, we have continued to work. Some of our colleagues were not able to go for the holiday to meet with their loved ones. Our national EOC had been on throughout the year, throughout the pandemic. Now we're having increasing infection in the health workers. And so we're appealing to our health workers not to let their guards down, to make sure that they adhere to the infection prevention and control measures that are in place in their facilities, and so as to prevent themselves from getting infected. In the last week, we have distributed actually IPC supplies to all the health facilities, the relevant health facilities, and also to the state. So we have enough of that at the health facilities. So they should not take unnecessary risk. We will also continue to support the NYSC. The batch, the stream 3 is starting very soon. So we'll support them and make sure that we test the core members before they go into the camp. Now, following the successful use of the RDT that we used during the NYSC campaign, we also have plans to roll out the RDT to the hospitals, especially the general and tertiary hospitals, to enable health workers and patients in line with, to test health workers and patients in line with our guidelines on the use of the RDT. We have also intensified risk communication activities. We've engaged media colleagues. We've aired a lot of jingles. But our data is showing the majority of the cases recorded are between the ages of 21 to 50. And this poses a lot of risk to the elderly, because majority of the young ones, we have a high percentage of young ones amongst us, very active, but then they have the elderly at home that they visit. During this holiday, I'm sure most of us went home to see our grandmothers, our grandfathers. And so, in the process, if we were careless, we would have transmitted this virus to them. And they are not that strong. Their immunity is not that strong to be able to withhold the virus, to withstand the virus, sorry. So I think we need, as a population, to advise our young ones to please adhere to the non-pharmaceutical interventions. We have seen where there are a lot of partying and beaching in places, and now we are seeing a lot of cases coming up. So the onus is on us, especially the young ones, to adhere strictly to the protocols for their own health and the health of people around them. We are working around the clock to protect the health of Nigerians, but everyone must take personal responsibility to support this mission. So we say, hashtag take responsibility. Thank you.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. Today I just wanted to reiterate parts of the protocol that continue to be valid and encourage members of the public to please comply with these measures for our own interest. The PTF continues to observe massive non-compliance with our protocols. The protocols were really put in place to not only manage this epidemic, but to also make sure that we are able to keep on top of our health system and to save lives. We are seeing an increased number of new infections in the country, and this is having an impact on our health systems already. And when it comes to mortality, it's not just those that die from COVID, it's also those that have other health conditions that may not be able to access health services, partly because the hospitals are overcrowded with patients with COVID. So I would like to reiterate parts of the protocol that continue to be in place, just for clarity's sake, so that the public will be aware. The nationwide curfew of 12 midnight to 4 a.m. remains. The wearing of face masks in public is still mandatory, particularly the implementation of the no face mask, no entry, and the no face mask, no service for all government and commercial premises. As stated by the chairman, we are working on a new set of health protection regulations that will support the Quarantine Act and hopefully will help us to strengthen the compliance with non-pharmaceutical interventions. When it comes to mass gatherings, a restriction is we're still restricting to no more than 50 persons, unless for religious activities where we strongly recommend not more than 50% capacity in a building, and preferably outdoors rather than indoors. For travel protocols, just to let you know that we have tightened up on our international travel protocols, and from Monday, the 11th of January, the PCR validity, the tests that people present outside the country that has to be negative for COVID-19, the time frame has been shortened from 120 hours to 96 hours, or 4 days, in order for us to fit in with other international requirements that are currently in place for a lot of countries. In terms of the other restrictions, just to remind you that government staff, grade level 12 and below, particularly the federal staff, should continue to work from home. Limitation of government meetings to virtual while maintaining restrictions on physical meetings. So if you're a government official, unless you really have to, please stay put and work from your base. We continue to have temporary restrictions on recreational venues, gyms and sports facilities until the 25th of January. And just to remind you that event centers, bars and nightclubs must remain closed. And we are grateful to those state governments that continue to enforce this across the board. So in terms of other issues, the PTF will specifically like to note the fact that our health system is currently strained. We understand the pressure that our health workers are currently undergoing. Clearly, they are getting overwhelmed. And these are our last line of defense when it comes to containing this pandemic. So for that reason, we will commend our health and frontline workers for their sacrifice and tireless efforts in caring for the sick, and the government is committed to ensuring that they have all they need in order to protect themselves and to mitigate the impact of the virus. In terms of, again, the issue of fake results, as the chairman mentioned, we are putting in place measures to stop this from happening. For people exiting the country, first of all, not every country requires a COVID-19 PCR test. So please check with your airline and check with the embassy of the country you're visiting. Do not check with touts. If you check with a tout and ask whether or not you need a COVID PCR test, they're likely to say yes, aren't they? So check and make sure that a COVID PCR test is required before you go around trying to get it. Do not waste your money on a COVID PCR test if it is not required for the country you're traveling. And the majority of countries in the world still don't require a test. If you do need a test, please do not buy a fake result, because it's criminal. We're putting in place processes. We will let you know by next week. We will have a fixed date beyond which, if you need a test, you have to go through the travel portal. You have to enter your details, print out a QR code, pay for the test, and in order to print out the QR code, by the way, you have to pay for the test, and you can pay directly to the accredited laboratories. You then get your sample taken. When your result comes out, it will reflect the QR code you have. And in future, in the next few days to weeks, we will make sure that every result presented at the airport has a QR code number that matches what we have on the travel portal. So that would stop the fake results issues from recurring, because you will not be able to print out the QR code unless you have gone onto the travel portal. And those links have to be there. The two documents will have to link. If they don't link, you will not be able to travel out of the country, because it's causing tremendous embarrassment to our country. In terms of vaccine, I'm sure you may have questions for the Executive Director of the Primary Healthcare Development Agency, but just want to inform you that we are rolling out a vaccine awareness campaign with the agency, and this is really to equip the public with the needed information required to trust and accept the vaccine, as well as to deal with the substantial amount of misinformation that is out there with regards to vaccination, COVID-19 vaccination. In terms of testing, we congratulate 4 states for achieving 1% of their testing target. FCT is way ahead. FCT, as at the 3rd of January, has tested 3.56% of their population. Our target was 1 to 2% of the population. Lagos has achieved 1.5% of the population tested, Rivers 1.2%, and Plateau State 1.04%. The reason why we're interested in testing is if you have a problem, you need to know that you have a problem, and you need to know where it is. Without testing, you wouldn't know. The only way you'd know it would be when your hospitals start getting filled up and people start dying. So for that reason, we continue to thank state governments for working with us. We had a meeting of the Honorable Commissioners of Health throughout the country today. We have strategized with regards to ramping up testing across the country. As I said on the last time we met, even though we are testing a lot more, last week we tested 37,000 samples, but 3 states, 37,000 samples in a week, but 3 states tested only 6, 11, and 26 samples for the entire week. Very little. And even though we've now crossed the 1 millionth test in the public sector, there are states that have tested less than 500 of this since we started the epidemic. So we're still grossly under testing, and this is reflected, of course, in the number of persons we are getting going into the hospitals versus what we actually have on the ground. I think there's a lot of transmission going on in the communities. So we have now at least 69 public health molecular laboratories across the states, and we urge the states to continue to work with us. Those states that have problems with their laboratories, we're very much aware. Those that have issues with test kits or extraction kits, we've taken it up with NCDC, and we will work with you towards making sure that, that anybody who requires a test for COVID is able to get it done free of charge unless you are traveling. So let us all please play our part. Thank you.
Good evening. The first question was from channels around the efficacy of the vaccine against the new strains of COVID-19. Right now, we do not have any studies that have shown the level of efficacy of the vaccines against the new strains. And one thing that I'm mindful of the fact that in Nigeria, we're still searching for evidence of the new strain. It is only so far in the UK that we're aware that the predominant strains are the new variants. I also want us not to obsess too much about this new strain, right? What the manufacturers have indicated is that even if there's a need to tweak the vaccine, it's not going to be a major problem in terms of the work that needs to be done to provide a vaccine against these new strains. So, for example, in America, in temperate countries, almost every year they have to change the type of flu vaccine that is given just because of the rapidity with which mutation occurs with the flu vaccine. So it is something that is happening, but it's a great thing that technology is also advanced enough to be able to produce vaccines in such a short time as to counter whatever new strains are available. The second question was from Nancy. What are the investigation and how long the protection will last? So one thing that we are aware of is that this vaccine is new. So we do not have absolute information around how long it lasts because the vaccines are just a few months old, right? It's going to be a question of time before we know exactly how long the immunity will last. So this is information that will gradually become more available. In terms of the prioritization, yes, I mentioned that we're prioritizing health workers, and she was curious about what strategic country leadership means. What it means is that, for example, I believe that on Tuesday, I mentioned that I would like to see a situation where Mr. President, the Vice President, the SGF, critical leaders come and take the vaccine in the full glare of the public to demonstrate that this vaccine is safe. So we have to make provisions for those. But even in developed countries, what we've also seen is that apart from the prioritization of health workers, you have to also identify critical leaders that you don't want to be wiped away by the virus, right? So for example, in warfare, if you want to disseminate, you want to destroy your enemies, you look for the specific leaders, right? You look for the captains, you look for the generals, and once you decapitate them, then of course the team, the soldiers become weak. So as much as possible, you also don't want to leave your leaders vulnerable to COVID-19. It doesn't mean that you want to prioritize politicians. That is not correct. I emphasized during the last media briefing that we will prioritize our health workers because the health workers are the ones that are in direct contact with cases, especially those ones that work in isolation units. In terms of reinfection and herd immunity, there is no shadow of that, even from different vaccines that we've used in the past, that it is always better to use the vaccine.
For COVID-19, it will take approximately 10 years for you to be able to achieve herd immunity. So you can imagine how many people will have died if you're going to rely on herd immunity. The Swedes tried herd immunity, and I'm sure that if you go through the information that's available, they lost a lot of people because herd immunity just doesn't work. The Americans, touted it, and see what's happening in the US. Herd immunity is not the way to go. The evidence is there that when you use vaccines, you are more likely to quickly attain herd immunity. You are able to protect more people using vaccines. I would like to use this opportunity to once again reiterate what Mr. Chairman mentioned in his address, that we must not give way to the conspiracy theories. We must try to manage the information around the vaccines. Where people do not understand, please reach out to those who are scientists, who are public health experts. All of us here are Nigerians that take the issue of the safety of Nigerians very, very seriously. So please reach out to the Presidential Task Force. We have hotlines at the Federal Ministry of Health, at MPH-CDA, NCDC. We also have call centers where you can call and ask questions. And please, we have set up a Zoom link that will be shared with members of the Presidential Task Force media team so that we can have an opportunity to answer some of your questions even in greater detail. I'm sure that there are so many other questions that maybe this forum might not provide that opportunity for. So we look forward to getting that comprehensive list of all of you, and then we'll have those discussions in the next couple of days. We want to also assure the media that the Presidential Task Force is working very hard to try and provide information about the vaccines. We are cognizant of the fact that it's not enough to just present the vaccines, but providing information that articulates very clearly that these vaccines have gone through those processes that will assure us of their safety. Working with NAFDAC, no vaccines will be administered to Nigerians without clearance from the regulatory body that is responsible for clearing and certifying these vaccines as safe. These are the same vaccines, this is the same agency that certifies which drugs you take, which foods you take. Any medicament, any medication that is not safe for human consumption will not be approved by NAFDAC. The COVID-19 vaccine will not be an exception. Thank you very much. Sorry, I didn't get that question. Reinfection of COVID-19? Absolutely. There are instances of where people have been positive, they become negative, and then they get reinfected. So what we are aware of is that the immunity provided by antibodies after the initial infection probably lasts about 3 to 4 months. That's what the data is showing. In some instances, it might be 6 months. So the fact that people get reinfected is just lends credence to the fact that the immunity from the natural immunity is short-lived. This is why, the vaccines are likely to be a better bang for our buck. Thank you.
Is science, is facts. So, distinguished ladies and gentlemen, and those of our viewers that are at home, our only and continuous appeal is that let's stay with the MPIs, the non-pharmaceutical interventions, the wearing of masks, social distancing, avoid unnecessary crowd. Avoid unnecessary crowd. If you have no business traveling, don't travel. I've used myself as an example to tell you that I wanted to go home for Christmas, I couldn't. I wanted to go home for New Year, I couldn't. I believe I have a duty to myself and my family to ensure that I have an opportunity of spending more Christmas and more New Years into the future. And the only way I can guarantee that is if I take responsibility for my conduct and for my actions. And individually and collectively as a people, that is what we are appealing to you to do. Thank you, and have a good evening.
message. Please, may I now invite the Permanent Secretary General Services Office, Dr. Nnamdi Morris Berry, for his take-home message.
The Chairman PTF, other members of the Presidential Task Force here, gentlemen of the press, good evening, everybody. First and foremost, I want to appreciate the Chairman, the Secretary to the Government of the Federation, for his commitment and dedication in passing very serious messages to Nigerians on this very pandemic. I also want to thank other members of the PTF for their respective roles in ensuring that Nigerians are put on alert as regards this very pandemic. We've been informed and from evidence that the numbers are rising on a daily basis. And what this simply means is that we have a role to play. The whole public, the general public, the media, the subnationals have very critical roles to play to ensure that this scourge is reduced to the barest minimum. And to that extent, we are informed that the highest grade of victims in this scourge are people in the age bracket of 18 and 50. And these are the highly mobile set of the population. And the simple implication is that when this very high mobility grade of people move around to the society and contract this virus, they come back to the elderly ones at home and transmit this. And of course, the elderly ones are highly vulnerable. And what this simply means is that we are, at this point, endangering our parents, our brothers and sisters that are elderly at home. So the youths, you are advised, please, if you don't have any business moving out of your house, for now, stay with your parents, relax and enjoy your life, because it's only one who is alive that celebrates tomorrow. We've also been told that a vaccine will be around with us, but no one knows exactly the day it's going to happen. But before it comes, we have to remain alive to be able to welcome it and to receive it in good health. Remember that mass gathering is a major source of transmission of this virus. So avoid mass gathering, avoid exposure, avoid contacts, close contacts with people. Last week, 2 days ago, we were told that you should regard everybody you meet on the street, everybody you meet around, as a potential carrier of the virus. And by doing this, you take necessary precautions to avoid contraction of the virus. A very dangerous trend is the issue of fake news around the pandemic. Be rest assured and be properly guided that COVID-19 is a reality. So do not be deceived by peddlers of fake news on this very pandemic. You should not give room for conspiracy theory, because you have credible sources of information, appropriate government sources of information that you can obtain current news and current information about the pandemic. So avoid fake news peddlers so you will not be a victim of this scourge. You also advised to be conscious of the travel protocols of the country you are traveling. It is a known fact that it's not all countries that require test results. So if you do not have need to conduct any tests for the country you are traveling, do not waste your time and do not waste your resources. And of course, do not engage yourself in the procurement of fake results. Government has put in place measures to dictate results that are fake. And of course, the consequences are very obvious. You also reminded that testing remains a key strategy of our national response. And this simply means that you owe yourself and, of course, the government a duty to subject yourself to regular testings. And to that extent, state governments and other subnationals are encouraged from time to time to intensify testing, because that is the only way you can detect the virus early and, of course, take preemptive measures with regards to treatments. Finally, there is need for us to remain alive in this year, 2021. So you are advised, please, take personal responsibility for whatever that will project this very objective. And until we meet again next week, I want to thank everybody for being here with us, and of course, continue to be vanguards of this goodwill message. God bless you, and thank you for every Nigerian.